Welcome back. Thanks for staying with us here on Midday Kentucky. Prostate and testicular cancer, something that's on the minds of all men or anyone that cares about a man in their life. Joining me today to discuss the treatments and the issues out there, we have Dr. John Tuttle from Clark Regional Medical Center. Welcome to the show, Dr. Tuttle.
Thank you. Happy to be here.
First, talk to us about prostate cancer and testicular cancer. Who's at risk? Do people need to be getting screened?
Well, prostate cancer is a common condition. Our guidelines have changed through the years, but our current best practice guidelines is men who are otherwise at risk should consider prostate cancer screening between the ages of 55 and 70.
Okay.
Now, there's men that are higher risk, and those men are people who have a family history of prostate cancer.
Okay.
So they might want to consider prostate cancer screening as early as the age of 40. And those of African American race are higher at risk to develop prostate cancer, and they also might want to consider screening at the age of 40 to 55.
And what are some of the symptoms that you may need to get screened, or you may already have prostate cancer?
Well, that's one of the problems. When it comes to early prostate cancer, you're basically asymptomatic.
Okay.
It's only in late stages do you get symptoms such as bone pain, blood in the urine, voiding problems. So early on, those patients that we hope are curable, they're basically asymptomatic.
And what about testicular cancer? Is that similar in terms of early detection is hard? What should people be looking out for?
It is. It's the most common cancer that occurs in men between the ages of 15 and 40. So it's those younger men need to be on the look for prostate or for testicular cancer. And we encourage men once a month to self-examine, like we encourage women to breast self-examine once a month. Also men, and men often find a lump. It's usually painless, and they will find a lump, and if they find anything that seems to be a change in their scrotum or in their testicle, they need to go to their family physician and have that checked to be sure.
And you're a urologist. Are you treating these symptoms, or why would people come to see you?
Well, I'm a urologist, and we treat conditions of the kidney, the ureter, the tube that connects the kidney to the bladder, prostate, and the genital area. I do in the reproductive area. So that's our specialty, and that's what we're board certified to do. And referring physicians send patients to us. We're secondary care physicians in order to make sure that the best care is offered if there's any question about what may be going on.
And again, I think it's so important when you brought up that men should be doing those self-checks. I think women, we hear that all the time, to check yourself every month. What should men do if they find a testicular lump? Just reach out to their doctor?
Yes, if they feel anything different, even if there's nothing there, they need to go and have their family doctor check that out. And the family doctor might be comfortable with the diagnosis, say, oh, it's just a cyst or whatever, and might do another test such as ultrasound. But if there's any questions or concern, they would refer to urology.
All right. Well, Dr. Tuttle, thank you so much for coming in to give us this information. We appreciate you coming on the show today.
Very good. Thank you very much.
And we have all the information up on the screen. You can go over to clarkregional.org for more information. But stay with us. We have more Midday Kentucky after the break, including your weather forecast and entertainment news.